Sarah. I'm a registered nurse with Live Healthy Chicago and Rush University Medical Center. And today we're going to be talking a little bit about managing heart disease. I'm going to go ahead and turn off my camera and share my screen so that we can get started. So, our goal today is going to be to learn more about heart disease and, most importantly, how to take care of yourself at home. We'll be defining what heart disease is, learning the facts, including symptoms and risk factors. We'll also learn a little bit about how providers test for heart disease and some of the long term complications that you may experience. At the end, we'll talk about self management tips. Heart disease refers to a type of disease that affects the heart or blood vessels, but it can be many different conditions. Each condition is slightly different, but many of them have similar causes, risks, and tips for management, which we'll go over today. Heart disease is sometimes called cardiovascular disease, which means the same thing. Cardio means of the heart, and vascular means of the blood vessels. Heart disease is very common in America. Nearly half of all Americans have some form of heart disease. In some neighborhoods in Chicago, that number can be even higher, depending on people's family history, diet, and how much they exercise. Heart disease is the leading cause of death in the United States. Today, we'll be talking about ways to keep you healthy and manage heart disease. These are some of the most common heart diseases, but certainly not all of them. Some of the ones listed here that refer to problems with the heart are arrhythmia, heart failure, pericardial disease, and valve disease. Some of the ones listed here that refer to problems with the vessels are coronary artery disease, peripheral artery disease, deep vein thrombosis, aortic disease, and cerebrovascular disease. If you've been told you have heart disease, talk to your provider about what that specifically means for you, your heart, and your blood vessels. Heart disease can be caused by many things, some of which you can't control, like your family history. Other causes of heart disease can be controlled in order to help you manage it, like smoking, diet, and your weight. Diabetes and high blood pressure and high cholesterol can be a combination of parts you can control and cannot. Talk to your provider about medications you might need to take. High blood pressure is also called hypertension, which is a term you might hear from your provider. There are many symptoms of heart disease, but some of the main ones are pounding or racing heart, fatigue, lower body swelling, shortness of breath, chest pain, and heartburn or indigestion. If you notice these symptoms, talk to your provider so they can do tests for heart disease. Sometimes, if you have heart disease, you might not have any symptoms, but it is still important to take medicine if your provider has prescribed it. One exception is if your chest pain is severe and happens all of a sudden, call 911 instead. There are a few tests your provider can do to check to see if you have heart disease. The electrocardiogram, or EKG, has you lie down and looks at the electrical activity of your heart over the course of a few minutes with electrodes on your chest. Aside from stickers on your skin, you shouldn't feel anything. The heart monitor is a longer lasting version of the EKG. It involves having a patch or small device on your chest for a few days, and it records the electrical activity of your heart. It will monitor for anything unusual so that your provider can assess the results later. This way, the provider can see what happens to your heart while you're resting, doing your normal activity, or when you're exercising or stressed. A cardiac CT or MRI involves getting pictures of your heart taken through x rays, radio waves, or magnets. It usually involves being still for a few minutes and having your body go through a machine to take the picture. Blood tests can be done from blood draws to measure your body's cholesterol and other markers to see how healthy your heart and blood vessels are. The stress test involves using the EKG while you're under some sort of stress, which is usually with exercise on a treadmill. And this is to see what happens when you're to your heart when you're not resting. If left untreated, there are several risk factors for having heart disease in the long term. Some of them include strokes, heart attacks, increased fatigue, and difficulty performing the activities you usually do. Blockage of arteries in the lower legs and tears in the blood vessels throughout the body are other complications. We'll go over tips to manage heart disease shortly, but it is important to manage it in order to prevent or delay long term complications. One of the biggest risk factors for heart disease is smoking and using tobacco products because it increases the risk of plaque in the blood vessels. If you smoke or use tobacco products, quitting is the best thing you can do to reduce your risk of heart disease or prevent complications like heart attack or stroke. Quitting is hard, but your body gets healthier each day that it doesn't have tobacco and can reduce your risk of a heart attack by about 50%. Talk to your family and friends about your goals to quit, and talk to your provider about resources that can help you, which may include medication or nicotine patches. It's important to know the indicators for heart disease if you've been diagnosed or if you're at risk. When you're aware of your blood pressure, cholesterol, and blood sugar, you can track them to see if your numbers are going in the right direction or not. Ask your provider for help to make sure you can keep an eye on these indicators. They may prescribe medications to manage your blood sugar, cholesterol, or blood pressure, and it's important to take all of these medications as prescribed. Heart disease may not have symptoms all the time, but it's still important to take medication to keep yourself healthy and prevent complications. Physical activity can make you feel better, function better, and sleep better, as well as help you lose weight. The American Heart Association recommends at least 20 to 30 minutes of moderate physical exercise at least 5 days a week. Figure out a way to incorporate activities that you enjoy doing, such as dancing, playing with your grandkids, or walking. Bring along a friend or a family member to make it even more enjoyable. 2 days a week, try to incorporate strength with weights or resistance band as well. There are many ways to modify your diet to make things healthier and help manage your weight for heart disease. Avoiding fast food in favor of homemade meals is probably one of the biggest pieces of advice, but sometimes people think that's more expensive. Frozen meat, fruits, and vegetables, however, are just as healthy as fresh without breaking the bank. Try going to the grocery store for fresh or frozen fruits and vegetables and avoid processed foods with extra sugar and salt. For sweet cravings, try berries and fruit instead of cookies and candy. White breads and pastas tend to spike your blood sugar, so try whole grain alternatives or brown rice instead. They also tend to have more flavor. Sodas and sugary drinks are less healthy, so instead try water with fruit or a sugar free drink like Crystal Light. Studies suggest that long term stress can increase blood cholesterol, blood sugar, and blood pressure. These are common risk factors for heart disease. This stress can also cause changes that promote the buildup of plaque deposits in the arteries, which can potentially lead to stroke or heart attack. If you have heart disease or are at risk for heart disease, it's important for you to manage your stress. Find something that works for you. Talking to a counselor or loved ones, meditation, listening to music, or even going for a walk in nature can be helpful stress relievers. Slow, deep breathing has also been shown to decrease stress. Try slowly breathing in through your nose over 3 to 5 seconds, then out through pursed lips like you're blowing out birthday candles. Try 5 breaths in a row with closed eyes. It is possible with appropriate management to prevent heart disease, or if you already have it, to be able to quit, to be able to manage it to prevent future complications. Quitting smoking, diet changes, activity levels, stress management, and monitoring your blood pressure and cholesterol are all important steps to make sure you get and stay healthy. This presentation covered information about heart disease as well as tips to manage it. But keep in mind that everyone is different. Some people may have different recommendations from their providers than others. So make sure you talk to your provider about what specific instructions they recommend for you. Thank you all so much for attending. I hope you have a wonderful rest of your day and stay well.